All right, good afternoon, everyone. I'll call this meeting of the Health Equity Committee, City of Norwich to order. It's 2:32 on February 10th, 2025. We will start off with attendance. I'll do a roll call. We'll start with the folks who are on Zoom. Patrick McCormick. Here. Melissa Myers.
Here.
Kate Mildy.
Here.
Chief Daly.
Here.
In the room, Joe Zuzel, I am present. Rob Scalise.
Present.
And Kathy Special.
Here.
Perfect. So no citizens' comments. Did anyone see the minutes? We all have a chance to look at that.
I did.
Okay, perfect. I will entertain a motion to accept the minutes as presented.
So moved.
Second, please.
Who is that?
That would be Melissa.
I'll second. It's Kate.
8 seconds. And all of those in favor, I'll go around the room. Patrick McCormick.
Aye.
Missy Myers.
Aye.
Kate Mildy.
Aye.
Chief Daly.
Aye.
Great. Rob Scalise.
Aye.
Kathy Special.
Aye.
And Joe Zuzel, aye. Motion passes, minutes are accepted. This will be a shorter meeting today. I just kind of want to tell everybody about where we're at in terms of, and Dr. McLean has just entered the room. So let it be noted, Dr. McLean is also here. So I just wanted to give an update in terms of where we're at, next steps. I want to thank everyone for their participation in the survey. I know that was not as easy as we thought it was going to be. I think it's really something to say, though, that we were actually able to mobilize that and get some really good data. I think we're waiting on one, but other than that, we've got all the data together in Excel. And as far as from my side of things, Kate and I were going to sit and sort of work on some draft, the draft plan, and then keep bringing it to the committee to see what you guys thought about it. So we have some initial questions right off the bat. And as always, anyone who would like to sit on the writing committee, you are more than welcome to join Kate and I, right? So just putting it out there in case anybody's interested. I had one of my staff members who is very savvy in the world of language learning models, take all the information that we had agreed on as a group and feed that into a language learning model to sort of give us an outline in terms of what we're working on. So basically what happened is all the information from the surveys, all the Excel questions, all the answers, we put that in. We put in the Norwich Census quick facts that we were talking about, the Uncas Health District information, the 2023 Norwich Equity Profiles from the schools. I also put in as a model, sort of as a structure model, the health equity plan that we got from North Carolina as that sort of an idea, right? And different amalgamations, it spits some things out, and needless to say, it's not publishable. I mean, that's how language learning models go, but it's a nice way to analyze a lot of data and sort of synthesize and get an idea about what our outline is going to look like and what this report's going to look like. I'd like to take some time today to just talk about that. I didn't give you guys a copy of it because, like I say, it is draft. Like it's embarrassing in some points, but otherwise it's pretty good. So
It's
I just
very good, Joe. You're understating it. It's impressive how much you guys were able to pull together so coherently in such a short period. Truly.
Appreciate that, Kate. I do appreciate that. I think there's opportunities though to it. And so I just want to kind of go over some questions today, and this will just kind of be a conversation in terms of structure, to talk about some of the things that we want to work on. So right now, as it stands, the document has some goals. So this is what it spit out, and I'll just read it. This document will, it says this in the executive summary, identify key health and equity issues facing Norwich. It will analyze disparities in healthcare access, economic opportunity, and public services. It will present strategic recommendations and innovative goals to improve equity outcomes. And it will provide data-driven solutions to ensure a more inclusive and healthier Norwich for all residents. So I just want to open that up to start to say, do you think that it's good to have listings of what our goals, what this document is aiming to do? And how are those goals? And do individuals have suggestions of things that are not there or things that maybe we should take out? And once again, I know you don't have it in front of you. I'm happy to repeat things.
Yeah, could you read that again?
So here we go. So identify key health and equity issues facing Norwich. I think that's important, right? That kind of stays in the document. That's what this document's going to do. It's going to analyze disparities in healthcare access, economic opportunity, and public services to the extent that we can. Sound pretty reasonable?
Mhm.
It's going to present strategic recommendations and innovative goals to improve equity outcomes. So far, so good for me. This one is the one that I'm a little, provide data-driven solutions to ensure a more inclusive and healthier Norwich for all residents. I'm not sure we have the kind of data-driven to provide those solutions.
And solutions, maybe more recommendations or than actual solutions?
Yeah, because solutions to me would involve collaborating with all of the town leaders and
Right.
whatnot. It's not for us from, I don't want to say external because it's not like we're not all in Norwich, but really external to the administration of the city.
Yeah.
Who are we to come in and say, here are all your solutions
Exactly. And
without involving them?
I'm glad to hear that coming from you guys, because that's exactly how I felt on that. And even data driven, I felt like data informed was more realistic about what we did, right? Because yes, we're taking data, but honestly, yeah, potential insights, I like that too. Honestly, I mean, we did a lot of qualitative data gathering, right? So to say data driven doesn't necessarily, the analyst in me does not necessarily want to just grab that. So I would say data informed, maybe, right? Something like that. What do you think?
I'll go with the flow, but not knowing where this is going to lead for us as a committee and for
Right.
commitments, I'm more in favor of just providing data that may be considered,
Okay.
toward the formulation of solutions, something like that. So
Data to
again, I'll go with the
be
flow, but
considered.
I thought our original mission was to provide data,
Right.
not to be making any recommendations.
Right.
Well, in a framework for the town, the city leaders to do this work, because that's who is responsible.
Right.
For the city, that the council is who was looking for how to move forward, and we're giving them a framework by virtue of how we did our surveys, what to consider in trying to seek out solutions, giving them a place to start.
Mhm.
And then sharing data that we have gathered, but we're not saying this is the exclusive data, this is the all-inclusive data,
Right. Right.
because there's certainly always more data that could
Okay.
be gathered, but we're providing some info and a framework for how to look at the problem.
Yeah.
Is
that's
how
great.
I see it.
I think that's great. So what I'm hearing is the fourth point. I'll really workshop that a little bit. Kate and I'll sort of dig in on that, put a couple of versions in there. But otherwise, those first three things, that seems to align with what we're trying to do, right? So that's good in the executive summary, kind of explaining what this document's all about. Okay, great. So moving forward, there's some structure that's built into this report, and it sort of has categories. And then what it does, it says key findings from those categories, and then what some of the challenges are, and then recommendations. And it does that for each category. So I'll give you an example. The first category is demographic and economic overview. And some of the key findings are Norwich has a median household income of $59,791, significantly lower than Connecticut's state average of $83,572. Homeownership rates stand at 53% compared to the state's 66%. Cost-burdened households spend over 30% of their income on housing and make up 39% of the population. 46% of Norwich's population are people of color, yet racial disparities exist in economic mobility and employment access. And so then it says economic and workforce challenges. It says that there's a lack of high-wage job opportunities for minority communities. Employment sectors dominated by low-wage industries such as healthcare, retail, and food services. Limited access to capital for small businesses owned by people of color. And then it has recommendations. So it says, implement a minority business development initiative to provide grants and technical support for small businesses owned by people of color. Expand workforce training programs in high-paying industries such as technology, clean energy, and advanced manufacturing. Create an economic mobility task force to study barriers to financial growth and propose policy changes. Now, let's just take the recommendations part out for a second, because I know that we're not necessarily making recommendations. What I'd like to see in recommendations is highlights from what we're doing in our own agencies, right? To sort of talk about that. So it wouldn't be recommendations. It would be like best practices or community practices or, you know, whatever we're going to call it. Like current efforts, thing. And I don't know if how the language learning model shifted this, if any of you wrote that in, any of those three things in as examples. Because there are some that it took some of our examples in and actually put them into there. So that's one question I have. But going back, do you think having a structure about the overall category, like demographic and economic overview, and then we talk about what the key findings are, what the challenges are, and then current practices, is a good structure to sort of go over these buckets that we've created? Do you think that that's kind of a nice way to organize it for readability? What do you think about that?
I like that. I think it flows nicely.
Okay. So if that's the structure that we'll work on, that helps Kate and I, because we'll be able to plug and play a lot easier with that. That's what I'm really trying to do in this meeting, is find out what the infrastructure, what the committee thinks a good infrastructure would be to build this as an outline, right? So that being said, I'd like to go over what these what the overall categories are, because as I mentioned, we fed it the North Carolina plan as an example of how to kind of structure things, but I know that we had specific categories for our survey. That being said, there are challenges and things to highlight in the area of disparities and health equity that didn't necessarily fit in our categories, but our categories explain those issues. So I want to go over what these highlights are, and I want to see if some of them need to be changed, eliminated, or maybe things added to them. So one of the categories is the demographic and economic overview. One is housing and neighborhood stability. One is health and healthcare access. One is civic engagement and public trust. One is environment and sustainability. And then there's a innovative goals section. So I feel like we're missing some stuff in there, and I feel like some of them might not be potential. What do we think? I can read them again. Want me to read them again? Demographic and economic overview. Housing and neighborhood stability. Health and healthcare access. Civic engagement and public trust. Environment and sustainability. One of the things I think is really missing is workforce development, right? I think like the pipeline. So I think workforce development has to be in there. We did a lot of work about answering trainings and, you know, things that we're doing. So I think that's an opportunity. Other opportunities, or ones that you think that are categories that you just are like, why is that in there? I can read some examples and show you how it categorized it, if it's helpful.
It doesn't seem institutional, Joe, as much as I thought. You know, it seems like it's looking at the city as a whole, but it's not speaking to what the city leaders want to do to integrate it within the work of the city hall, so to speak. So, you know, is there going to be policy development to support health equity? Is there going to be, to your point, the hiring practices? Is there going to be, you know, positions created? Will there be, you know, looking at contracts that are developed? Is there going to be, you know, personnel policies that will be adapted? I mean, those types of things kind of specific to the work of the city.
Yeah, I think that's a really good point, Patrick. There are sections in here that, once again, the model did this. So innovative goals for Norwich's future. So, and they have 5 of them here. So an equity scorecard for city departments. Implement a data-driven accountability system to measure progress in DEI efforts across all city agencies. A health equity navigator program, train community members to assist residents in navigating health and social services. We had something like this in the past, I think for Haitian Creole individuals, but Sheila would know better than me. Small Business Accelerator for minority entrepreneurs, offer mentorship, capital access, networking opportunities. Affordable Internet Access Initiative, address digital disparities by providing free Wi-Fi zones in underserved communities. Universal Pre-K for All, expand early childhood education programs to level the playing field for young learners. And then it's also got a section after the conclusions where it says immediate next steps. So form a health equity and economic mobility task force, secure funding through state and federal grants, engage the community in transparent dialogue. But I don't know exactly just how far we want to go in some of that. And we can say, you know, we can offer our current practices, and then we can say, you know, nationally, these are some other opportunities should you want to look at it. But those aren't the things that we're doing. But in those categories, to Patrick's point, do we think that we should have something that is specific to municipalities or something? I don't know how we would structure the data.
I even think of things like, you know, if you prioritize women and minority-owned businesses when they're applying for contracts, do you want minority-led businesses to get some sort of preference in terms of providing contract? You know, those are the types of things. And I don't know if it needs to be in our work.
Mm-hmm.
I don't know if that's getting too granular.
I mean, I think if we decide as a committee to move to that, that would be in conclusions and next steps, right? Not necessarily recommendations, but we could say, you know, at a national level. I want to be very careful that we're not telling the city what to do. I want to make sure, to Rob's point, that we are offering best practices. We have organized, have put this data together as something for them to really look at and to inform decisions. It's factual, you know, kind of tell where it comes from. But I think in order to get to those conclusions, next steps, we've got to figure out how best to showcase what we've collected so far and how we're gonna push those opportunities forward. So if we're missing a category like workforce development, for example, like environment and sustainability, is that one that's really important to the work that we're doing as racism as a healthcare crisis? And I'll give you some examples of what it says. So key findings: environmental hazards disproportionately impact communities of color. There's limited access to green spaces and recreational facilities in low-income neighborhoods. There's a high energy burden with low-income residents paying a disproportionate share of income for utilities. Sustainability strategies: create a green infrastructure grant program. Like, do we have, so because we're not going to use these suggestions, but do we have in our answers current practices that would address environment and sustainability? Because we didn't really focus on that when we answered the questions. You see what I'm trying to get at here?
And NCDC is working on that in particular.
Okay.
You know, they're talking about green spaces and that kind of stuff.
Yeah, yeah.
Things that they're working on.
Yep.
So
maybe, I mean, that could be something that's highlighted, right? Maybe that's a highlight from the city, which would be really nice. So, I mean, we could.
So can I make a suggestion?
Sure.
I'm sorry. So they gave us, when they created this coalition, I can't remember what the original title was, but there are 13 points that they wanted us to respond on.
Right.
And in our surveys of ourselves, we have created current efforts. We have documented current efforts that address our 5 areas, well, 10 really, in our group, that we looked at things like data and workforce and direct service and all of those things. And when I look at the 13 points that they were looking for, I know one is a health equity plan, but that's really kind of summarizing all the rest of the things that are listed here. So if we were to take each point, like there's a workforce question. And you know, one of the items was charged, our group was charged with, was to promote racially equitable economic and workforce development practices. So our recommendation back is here, or our advice or our enlightenment
I love that.
reflection,
Enlightenment.
whatever we want to call it. Here are our best efforts. Here are your healthcare leaders in the area
Yeah.
and other community leaders as what we do that we feel helps to promote racially in our efforts as an organization in the Norwich area, any one of us in the group. This is what we do now. And we share that with you as an example of what you could consider. And then if we had a data point in any of our data reports that we've gathered, Data Haven or any of the others, about workforce in Norwich, then you're tying the data and our current efforts. Done. That is number
I
two.
really like what you're talking about.
It's
So you're saying
answered.
the
We move on to the
categories.
next question. You know
Yeah,
what
yeah.
I mean?
So the category should be based on the 13 points.
Exactly.
I
Like,
love
given
them.
that, my experience with city councils is it is very point by point, that everything needs to be mapped over. And so if these were the things they were looking for, let's give them back the information they wanted for these points. If there's a data point in any of our sources that ties to that, let's put it there. So we're sharing data on that point, but also our current practices, have at it. That is our, that's what we have to share. And the whole thing together are all of the components that you would craft together to create a health equity plan. If you were to address the environment and the data and the workforce and the direct services and professional development, all these things, this is creating steps towards a plan for you. It's
I think
your
that's
job,
great.
I think, to decide how it applies to them.
Right.
But that's what I would say.
What does the rest of
Right.
the committee think about that? I mean, makes sense. It makes a lot of sense to me.
Same too, and
Yeah.
I agree with you, Mace. I think they'd be looking at, this is what I gave you, this is your response.
Mhm.
Exactly.
That's how most towns operate.
This is the 13.
Yeah, and like I said, we could, if they all stand on their own, like there's going to be some of these that don't necessarily stand on their own, so we'll have to like fold them into a greater category. But yes, making sure that all of this goes into that, like focus on access to prevention and treatment that's culturally and linguistically competent. That goes under healthcare access, right?
Right, and then we say what?
Engage historically marginalized communities in identifying problems and solutions, supporting community-driven responses. That's community outreach, right? Our China,
Yep.
our goals, right? So
Right.
like a lot of these things fit in there, but I think it's important that we put these original things under there. So even if the category was healthcare access, it addresses
Right.
point 3, 6, 7, and 8. Right? And we
Exactly.
can do it that way. I like that a
Exactly.
lot.
Look at number 9, there's a lot in there about the specific.
Yeah, 6 is huge.
Yeah, 6 is big and 9 is big.
But
That gives me a good.
I think there's a way to like take our work and tie it over, you know
I
what I
agree.
mean, and drop it there.
I agree. Thank you for that. And if everybody's in agreement, that's so we'll continue with that structure of findings, challenges, and then current practices. But what the categories that will guide that will be informed from the 13 points and how that fits under our current committee strategies or another one, how it is, but we'll cite it so they line up. So all this will line up. Let's get a little bit in the weeds and then I won't have much left to ask questions about. So when we're talking about current practices, I wanted to get the committee's feeling on this. So many of us are doing such amazing things, right? There really a lot of standout stuff that people answered, a lot of really cool initiatives and programs. Should we talk about the initiative and program as just the initiative and program, or should we give kudos and more awareness to the agency that it comes from? Because I don't want to call out agencies if people don't want to be called out. But I think that once again, if we think back to what we're trying to do and are being transparent about the work that we do, and that's a challenge that I have all the time, right? How do I talk about the wonderful things that we do? How do we get that information out there? How does the town know? How do individuals know? What's the feeling about that? Should we give credit where credit is due? So we could say, as an example, Uncas Health District does a program where yada, 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 and that's a current practice. Right? Generations engages in blah, 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 which is a current practice.
I
So
have no
brings on
problem
You
having
have no
generations
problem.
listed to any of our answers. I'm just gonna speak for generations. Because if they want to call to ask, hey, we didn't know about that, et cetera, I assume we're gonna give them contact info for everybody involved.
100%.
I don't see why not. We should be available to help them, but that's just generations. I have no problem being listed with any of my answers.
I'll speak from HHC that the information that we gave were fine to be called out and not to be on ours.
Maybe we could just ask each member individually, privately,
Sure.
whether they want to
Yep.
be listed or not. And if they don't, then they don't get listed.
Yeah, let us know. I just wanted to make sure that I was being sensitive to that. I mean, honestly, I don't think that there's anything that anybody wrote that is not something that is a positive, and we're not highlighting anything that would be construed as anything but positive. When we're doing current practices, it is, hey, this is great. This is a great idea. Do with it what you think, but this is awesome. We're not saying like, well, these agencies didn't have XYZ and these ones did, right? That's not what that section on current practices is about,
Yeah,
right?
not competing.
No,
No.
and we're not calling out where there's holes, right? Or opportunities, right? Because I think that's another thing too, when you're filling out the survey, I've heard from some members where, I didn't really think about the stuff that was formalized or not formalized, right? I didn't really think about the fact that like I'm doing this program, but maybe there's somebody else who's also doing this program at the same time, right? Like there's a lot of times where I think even the exercise of doing it ourselves sort of puts into a context of like, interesting, right? Like that's what we're hoping to get from this too. So contact me individually, please, if you do not want to be called out. Otherwise, I will take no emails as we're good with it. All right. That's about all I got. I know that was a lot in a very short amount of time, but I just needed some like directions to be able to kind of steer. So Kate and I can kind of steer this a little bit more. Questions, other things that you think we should put out there as we're starting to formulate this, things to keep in mind. I know you basically just got to see it to pick at it, but
Thanks for doing that.
yeah, no problem. All right. Anything anyone else wants to talk about that isn't related to the community, to the health equity plan before I entertain a motion to adjourn? Hearing none, I will entertain a motion to adjourn.
Motion.
All right, Kathy moves. Can I get a second?
Second.
Second, Patrick.
All right, Dr. Qureshi gets the second. And we will go around the horn again. Patrick McCormick,
Aye.
Melissa Myers,
Bye.
Kate Mildy,
Aye.
Chief Daly,
Aye.
Dr. McLean, Dr. Qureshi,
Aye.
and in the room, Kathy Special, Rob Scalise,
Aye.
Joe Zell, aye. Motion passes. We are adjourned. Have a fantastic day, everyone, and we will talk to you soon.
Thank you.